We're so excited you're here with us to have your baby. This video provides an overview of some things you may see and hear while you are here in labor. You will get information every step of the way, but sometimes it's nice to know a little bit beforehand. When you arrive at Cass Health, we recommend you use the emergency department entrance. You can also use the main entrance Monday through Friday during the workday. After checking in at registration, you'll proceed to the OB department on the second floor. On your arrival, our OB department team will greet you. Depending on where you are at with your labor, we may do some initial paperwork and input your information into our computer system. Once you're gowned and comfortable, we will begin fetal monitoring. Fetal monitoring is how we listen to your baby's heart and look at your contractions. 2 round monitors are held on by bands that go around your stomach. How much or how often you are monitored just depends on what is going on in your labor, and we will explain that each step of the way. Just remember that even if you're on the monitor, it doesn't mean you have to be in bed. We have portable monitors that are waterproof, so you can shower, walk the halls, sit on a labor ball, or in the rocking chair if you would like. We check to see how often you are having contractions, but the monitor doesn't always tell us how strong they are. You will be able to tell us that. We also check your cervix. Your doctor may have already done one of these checks at an office visit. We do cervical checks to see if your cervix is dilating or effacing. Dilation is the measurement we use to describe how open the cervix is. It is typically measured in centimeters from 0 to 10. 0 centimeters, your cervix is closed. 10 centimeters, you're fully dilated and ready for birth. Effacement is a measurement we use to describe how thin or shortened the cervix has become. It is measured in percentage from 0% to 100%. 0% equals no thinning, cervix is long and thick. 100%, you're fully thinned out or you're effaced. Position is a measurement we use to describe how far the baby has descended into the pelvis. It is measured in stations. 0 station, the baby's head is at the level of the ischial spine, or the middle of the pelvis. Negative numbers, your baby is higher in the pelvis. Positive numbers, the baby is lower, moving toward delivery. Your doctor will decide how to start your induction based on those measurements. Cervical checks aren't done at any certain times. They are done when you may feel like something is different, when your baby shows us something is different, or it has been a while, we are wondering how things are going. You have the right to decline these at any time. The doctor or nurse should always let you know what they are doing and get permission before doing one. As labor progresses, we encourage you to have the labor experience you would like. Movement is always great. We have labor balls, peanut balls, a cub, and multiple nurses who can help with different positions to help you with not only discomfort, but to get baby in a better position for birth. You are encouraged to use whatever technique works best for you, whether that is breathing, massage, or movement. And if you aren't sure, we encourage you to ask your nurse for ideas to help. For pain control, you have options. Some moms know they want an epidural as soon as possible. Some moms prefer alternatives. It's your choice, and we're here to answer your questions about each. We often start with movement, position changes, massage, breathing, showers, and pressure points. Your OB nurse can help offer advice and support with these pain control methods. We can also provide IV pain relief, and there are a few different medications the doctor can order for you. These medications are safe for you and baby. IV pain medications don't make the contractions go away, but they do help take the edge off and give you a chance to rest between contractions, so they can be a great choice. Since these medications are IV narcotics, we try not to use them after 8 centimeters of dilation. This is because they can make both you and baby sleepy. They wear off fast, but sometimes after 8 centimeters, babies can be born quickly, and we want them awake and alert. The next option for pain relief is an epidural. This is a medication that is given through a plastic catheter that is placed in the epidural space in your back until after your delivery. We have multiple certified registered nurse anesthetists, or CRNAs, here at Cass Health that are either in-house during the day or on call at night. They can walk you through the process and help you have a more comfortable labor. The goal of a good epidural is to get the contraction pain under better control. Still have some use of your legs, lifting them, not getting up and walking, and feeling some pressure when it is time to push. If you have any questions about epidurals, our CRNAs are happy to talk with you. Once it is time to push, there are a ton of different options. Some people like to push on their back, some on their side. Some people like to push on their hands and knees. We also have a squat bar that some people prefer. You might also use a combination of different pushing techniques, and your OB nurse is here to help you try out what feels best for you. It's good to know that sometimes pushing can take a little while. For first-time moms, pushing can take anywhere from just a few contractions to 3 or 4 hours. Once your baby is born, we ask you what your preference is. Some parents want skin-to-skin contact right away, or some might opt to have baby placed on a blanket on top of mom right away. We'll ask about cutting the cord, and your doctor will then wait and prep the cord for clamping and cutting. Next, baby is snuggled skin to skin with mom for as long as desired. If you choose to breastfeed, we will see if baby is hungry and help them get latched. When you're ready, we will take baby to the warmer right inside your room to find out their weight and take a few other measurements. The last few parts of labor are the delivery of the placenta, which happens a few minutes after birth. You may be asked to push gently, but you also might not need to push at all. Your doctor and nurse will let you know what to do. If you would like to keep your placenta, please let your OB nurse know at this time. After the placenta is delivered, your doctor will check to see if you have any tears that need stitches. These are absorbable, so they will not have to be removed. Your nurses will teach you how to care for them afterwards. Fundal massage. Even though this sounds nice and relaxing, it's sometimes not as great as it seems. When we have a baby, our uterus gets a lot bigger than it usually is. After delivery, your doctor, then your OB nurses, will be rubbing on your stomach to make sure your uterus is shrinking back down to how it's supposed to. This is done after a vaginal and C-section delivery. It can be uncomfortable at times, but we promise you it is very important. Having a baby is hard work, and it's normal to feel discomfort afterwards. Ice packs, Tylenol, ibuprofen, Dermaplast, Tux pads, and sitz baths can all help ease postpartum discomfort. We encourage you to talk with your nurse about what's safe and best for you. Those little comforts can make a big difference while you heal. Talk to your healthcare professional about using a stool softener or a laxative. These medications may help prevent problems with bowel movements, such as constipation. Tell your healthcare professional if you have intense pain, long-lasting pain, or if the pain gets worse. This could be a sign of an infection. You will notice some bleeding after delivery. It can seem like a lot, especially after 9 months of not having anything. We will monitor how much bleeding you have and even weighing your pads for the first 24 hours after delivery. This just gives us a better idea of how much blood loss you have. You can expect to bleed for a couple of weeks after delivery, and we will teach you all about it while you are here. The epidural will get turned off after you deliver. It can take a few hours to wear off. Then we can help you get up for the first time. Your OB nurse will take it out for you and assist you to the bathroom for the first time. Please don't try this on your own. Congratulations, you've successfully welcomed the newest member of your family into the world. Along with routine follow-up appointments for you and your baby, we offer a free weekly support group called Mama Meetups. This is a come-as-you-are group where you can talk, learn, laugh, and spend time with other new moms going through the same phase of life. During this time, you can learn about postpartum care, check baby's weights, get feeding advice and help, talk with a nurse about your questions, and spend time with other moms and babies. No appointments or reservations are needed. Again, congratulations on your newborn, and thank you for choosing to have the best birthday ever at Cass Health.